So what you do is A1, greetings, introduction, nature of interview. What is the conversation going to be based? And let me tell you that if somebody has hyperemesis gravidarum, like the one we talked a while ago, you can see on the face of the patient that the patient is unhappy. So I call that spotting anxiety. Spotting anxiety means you can see on somebody's face that patient is anxious. You can see on somebody's face that the patient is angry. You can see on somebody's face that the patient is agitated. You can see on the patient's face that the patient is happy, right? So if the patient is happy, you congratulate. If the patient is unhappy, you're going to spot that, and of course, you're going to do the A4. You're going to say, "I'm sorry to hear this," or "I'm sorry to hear about your situation," or "It must be hard for you." Give such kind of statement, right? So greetings, of course, hi, hello, good morning, good afternoon. Obviously, introduction means who you are. If it's an outpatient setting, you need to ask your name. Sorry, you need to tell your name and ask the name of the patient as well. Nature of interview means what are we going to overall talk through the conversation? We need to clarify that, right? We'll talk about that in a while. A4, of course, sympathy, empathy. B1, I've already told you B1 and D2 can be connected. We can do it at once. See, using initially open questions. And B1 says we're going to elicit and explore the patient's ideas, concern and expectation. So if I say, for example, yeah, I have a headache. Yeah, I have a headache. Then you can say, okay, when did you have the headache for the first time? Have you taken any medication? These are the questions that you generate to explore the patient's idea or concerns. That's what it means by B1. And since D2 says that you have to use open-ended questions, right? Using initially open questions. So why not to construct the curiosity that you have with open questions? Instead of saying like, do you smoke? The answer is going to be either yes or no, isn't it? That's a closed-ended question. Why not to make it open-ended? What about your smoking? How long have you been smoking? This kind of things that comes here. So let me generalize the OET's cue card. How? The second half of the tasks that you have in on the cue card will always be, remember, suggestions. If the patient is a smoker, you're going to tell the patient how to reduce the number of cigarettes the patient smokes. If the patient is an alcoholic, you're going to tell the patient um, how to lower the number, not the number, sorry, volume. Similarly, if the patient is depressed, anxious, is obese, you're going to give suggestions accordingly. So when you go towards the bottom on a cue card, you'll always see that most of the time it will always have suggestions. So how do we prepare? So please memorize these if you want to do well with the exam. A1, I always forget E1 when I do the speaking. Everybody has a kryptonite. Mine is E1. Always. I've I always forget E1 when I do the conversation. So maybe there's another problem for you. Maybe you have your own kryptonite. So you have to practice accordingly. So since I'm not the one who's going to be judged, you're the one who's going to be judged and recorded. So you have to make sure that these things are included in your speaking. So we have A1, A4, memorize them. B1, B3, memorize them. Then we have C2 also, that's very important, but don't think about it now. D2 is important and E1 is important. So if you do this, let me change the color. Let me make it green. So let's say A1, A4, B1, B3, D2, and E1. 1, 2, 3, 4, 5, 6. These three criteria will make your initial 3 minutes smooth. And after the 3 minutes, what happens? Let's imagine, let me give you an example. So this is, these two are the river banks, two opposite sides. Yeah, there's water. You come here and you have to cross. So C2 is going to help you cross. Or E4 is going to help you cross and change the topic. Sorry, E4. Wait. E4, yeah, E4. You getting me? So this side of the riverbank, this side, this side, riverbank, what are we going to use? We're going to use these. Let's see. We're going to use this one, these six criteria that I talked to you about. So you've used these six criteria to reach the midway. Yeah. B1 usually comes with D2 hand in hand. And E4 and C2 will help to go towards the next part. I mean, everything that we've explained, E4 says, are you getting me? Are you understanding me? Do you get me? Are you with me? And when you cross the river, then we have suggestions. We're going to use C2. So let me give you some suggestions how to reduce smoking. Let me give you how to control the alcohol intake. These things become your C2. I hope you understand. Don't focus on other things at the moment. I'm going to add little by little every week, and you'll get more and more fluent. But you have to take any speaking cue card in this way. So first of all, when you see a cue card, what do you need to prepare? You need to prepare these six, as far as I'm concerned, because most of the times the candidate make mistakes with these six criteria, and that's the reason why they don't score in the exam. Yeah, I'm going to remove this from the screen. Now let us come back to our speaking cue card. Now, how do we prepare? Let me show you. Now, first of all, we have to establish the fact whether the patient is in a hospital setting, is admitted, or in an outpatient setting. It clearly says hospital ward. So you do not need to ask the name of the patient. You just introduce yourself, and then remember in A1 there was nature of interview. So whenever there is anxious and anxiety given, you can always and almost always include that in your speaking or in the initial statement. So 29-year-old nullipara woman is diagnosed with this. She's commenced on yo, and IV ongoing. We don't see any anxiety there. Okay, so you do not need to do it. So how do we start the conversation? So hello, my name is Nishant. I'm your attending nurse here in the ward. I've come to know from the notes that you've been diagnosed with hyperemesis gravidarum, right? So another thing that you need to spot is that look at this. Look at the first task. What it says. It says answer the patient's question. That means you have to create a circumstance where the patient asks you a question. So we did greetings means good morning, good evening, good afternoon. Since the exam is going to be conducted in the afternoon, you can just memorize good afternoon all the time. Then we have the second part. Hello, my name is this. I'm your attending nurse here in the hospital ward. I've come to know from the case note that you've been diagnosed with hyperemesis gravidarum. Is that correct? We can double check with the patient. And then we have to create a situation where the patient asks us a question. So you look a bit concerned. You look a bit concerned. What is bothering you? And then the patient will start talking. Yeah, okay, blah, 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 blah. We can do a little bit of cheating. You see what's the patient going to say? The patient is going to say, ask the nurse to explain what hyperemesis gravidarum is and what is the implication or what the implications are for the baby. Well, the implication means ke huncha bachchalai. You bhai bhane. That's what it means, right? After that, the conversation starts. So when you do A1, and then first of all, I'm really sorry that you've been diagnosed with hyperemesis gravidarum. That is going to be your A4. B1, after you hear whatever the patient has said, you're going to explain what hyperemesis gravidarum is. That becomes your B3. But you're going to show that you care for the patient, so you're going to construct few questions that may or may not be given on the cue card. That's going to be, since when did it start? What did you do as the initial management? Right? Right? How many times have you vomited? When did you present to the hospital? This kind of questions you can form, create. Why did I create everything that is with W because that's an open-ended question. Because D2 clearly says that it's better to use open questions initially and then later move towards the closed-ended questions. You get me, right? And that's how the conversation starts. Let's try, everybody. So on a piece of paper or whatever you have in front of you, you need to prepare your A1, A4, B1, B3. Let's ignore C2 at the moment, and then we have our E1. So when you write this on the piece of paper, because in the exam also you'll be given a blank sheet on which you can write, or even on the cue card itself you can write, and you can just read it out. Yeah, and make it. You have to make sure that you sound as if you're speaking, not reading. You also have to ensure that because there has to be appropriate pauses when you speak. Yeah, check. So let's say we start. Let's say Sabina, you can start.
Hi, good afternoon.
Hello.
My name is Sabina. I'm the one of the nurses working in this hospital ward. Today I'll be taking care of you. You look really concerned. Is there anything bothering you?
Yes. First of all, can you tell me what is my diagnosis? What does my diagnosis mean? And what is it
Oh,
going
okay.
to do to my baby?
Okay, sure. Please don't worry. I'm here to explain you regarding your condition. I can understand. Since this is your first pregnancy and you have been diagnosed with hyperemesis gravidarum, I can understand how worried you be. Before proceeding further, I would like to ask you a few questions regarding your condition. Will that be okay?
Mm-hmm. Okay.
Okay. So, since when did you started vomiting?
It's been going on for 4 or 5 days already, but recently, before I presented here, it has gotten worse.
Mm-hmm. Okay, okay. So you said like you have been vomiting for 3 to 4 times a day.
Well, yes.
Okay. So normally during pregnancy, women will be vomiting, but at your condition, doctor has diagnosed with you hyperemesis gravidarum, which means that it's a condition. It's a little bit abnormal condition associated with pregnancy, which means there will be prolonged vomiting. Do you get my point?
Okay, so what is it going to do to my baby? I'm worried that I'm going to lose my baby.
Okay, okay. Don't worry. Please, I will explain you everything. What happens is normally when you vomit for a long period of time, you will be losing a fluid and electrolyte from your body, and then you will be losing your weight also. However, please not don't worry. There will be no effect to your baby, and you will be having a safe delivery. Okay.
How long is it going to take for me to get better? Is it going to persist
All
throughout the
right.
pregnancy? I've been vomiting
Mm-hmm.
continuously. I don't feel good about it.
I completely understand how you might be feeling. As I mentioned earlier, also, like you women's will be having this vomiting problem in their first trimester. However, some women's will be vomiting for a long period of time, and this disorder is called the hyperemesis gravidarum, which is also diagnosed for you. And we have been treating you on a IV therapy, and we are giving you the replacement fluids to stabilize your condition. Are you following me?
Yes, yes, I get that. All right.
Okay. And on top of that, also you are having a good bed rest at hospital, and we are giving you oral medicines, which is anti-emetic and that prevents vomiting. And until and unless your condition will be stabilized a little bit better in a better way, then we can discharge you. All right. Are you getting my point?
Okay, yes, I get it. Okay.
So I can understand you might be like worried about your baby, the medicine which you are taking might harm your babies, things like that. But I completely reassure you that these medicines will not be harmful to the baby at all. And I have discussed your case early in the morning with doctor, and you will be having a safe delivery. So don't worry at all. Okay.
Okay, I understand. All right.
Okay. So is there anything like that's bothering you regarding your condition?
No.
Okay, I understand like how you must be feeling like you are admitted in hospital ward during your first pregnancy, and you are going through all this vomiting for a prolonged period of time, and you will not feel like eating anything. I completely understand how you might be feeling. However, like we and our entire team are here to support you, and until and unless you feel better, we will treat you well in hospital. And I guess I can call your husband also just to talk and make you feel better. How does that sound?
Okay, yeah, yeah, that sounds good.
Yeah, okay. So I'm going to give a call to your husband to just visit you so that he'll be here for you for your emotional support. And um, is there anything else you would like to ask me about?
No, I'm quite all right for now.
Okay, and then I feel like I was able to answer your questions. Once again, I would like to reassure you that you will be fine and you'll be having a safe delivery. However, until and unless you feel like eating through your mouth, we'll be putting you on this IV therapy through which we are giving you medicines as well as fluids. You know, like when you vomit, you lost a lot of fluids, right?
Mm-hmm.
For that reason only, we are giving you the supplement through the IV, and also like we are giving you medicines also which will control your vomiting. But don't worry, it will be not like at the moment. It will be like slowly recovering, and
Stop.
gradually you will be fine.
Okay, no issues there. Let's see the next. Poonam. Poonam, you can try. Or Sumnima, you can try. Or Sumina, sorry. You can give it a try. Just be a nurse. Just give it a try. Just be a nurse. You do not need to add anything about OET. You can just talk normally to somebody who has hyperemesis gravidarum. Yeah? Just talk that much. Normally. Sumina, you can try. At least A1 and A4. Good morning, good afternoon, good evening. Da 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 da. Yeah. Just aim for 2 minutes. Doesn't matter. Doesn't have to be full 5 minutes. You can speak. Just be a nurse. Don't think anything. I'll give you the comments if there are any issues. Go.
Okay. Hello, good afternoon. My name is Sumina. I'm your attending nurse today. You look a little bit concerned. What is bothering you?
Very good. I know about my diagnosis. It's a weird name. Can you tell me what does that mean? Hyperemesis something.
Hypermesis gravidium. In pregnancy, some women suffer from hypermesis gravidium. Uh, uh, it may it means you are experiencing vomiting a lot. Some in pregnancy, some women experiencing vomiting, but in hypermesis gravidium you vomit a lot, so you are admitted at hospital uh, because your electrolyte
Keep going.
will be disbalanced, so you have to admit it in our hospital, and you are now in IV therapy.
Okay, so what about the implication? What's going to happen to my baby? Am I going to lose my baby? I'm so worried because I've been vomiting more than usual.
You don't have to worry about your baby. Your baby gonna be okay. um you go in future, you will have a safe delivery. um, right now you are in a hospital because you had a prolonged vomiting. Before you admitted in hospital, how many times you vomited?
I don't know. I did it maybe 14 or 15 times. That's why I came here.
Oh, okay, that's why we had that's why we have to put you in IV therapy. So you don't have to worry about that. um मलाई त भन्ने आएन.
It's fine, fine. Do B1 now. B1 when it's questions or so. So the ठीक it's good. Give her a little
Uh,
bit of reassurance that you're not going to lose baby. It happens. Blah blah blah. That's it.
mm, मलाई त
Go to the next one then. Talk about the medication.
okay. You will on medication um, until the end of second trimester. Oral,
Mhm.
we will put you on oral antiemetic medication. Is that okay?
But what if the medication that I take is going to hurt my child?
I assure you that that medication will not hurt you or your baby. I already tell you, you will have a safe delivery, so you don't have to worry about that.
Mm.
Okay, is there anything you would like to ask me?
No, not at the moment.
Okay, I will tell your husband to visit you for some emotional support. Is that okay?
Yes.
Okay. So,
All right. Not bad. Yeah. See, instead of giving a statement, I'm going to tell your husband. How do you know that the husband is there? Why not to make it into more questions? Like, you show your curiosity. How? Okay, who's here with you? Are you here by yourself? This kind of things.
okay.
And then she'll say by herself, "Oh, my husband's here." So how about I send your husband here to sit with you for a while? It's going to make you feel better. Yeah, such thing. Okay, not bad. Mm. This pachi, let's try. Punam. Punam. What's going on there? All right. Then that's the homework. Practice this one yet another time. Yes. Sumnima and Sabina tried. Practice this. Check the criteria. I'm going to send it to you all. I should send everything to you. We can give it a try again, maybe tomorrow. Just check it out once if you have done it well. Then we have homework, uh, the writing. Okay, let's finish this, and that's it. I'll send you all the materials.